Cardiovascular disease gets a lot of lip service as a big term, and it means a lot of different things, because the heart and blood vessels that circulate that blood around the body are the principal pieces that are involved in cardiovascular disease. And so there's a lot of things that could go wrong. There's things called congenital heart abnormalities. These are things that you're born with. Sometimes they're detected when you're a child, and we have marked advances in surgeries and that type of thing to be able to allow those kiddos to grow up to be adulthood, but they still have issues from an adult congenital heart disease standpoint. That fits in there. There's some things that are congenital heart defects which aren't picked up till adulthood. Sometimes those are holes in the heart. Sometimes it's what's called a bicuspid aortic valve, where one of your valves only has two doors or two leaflets to it rather than three, and other conditions which come up later down the road. There's the most typical cardiovascular disease, which is what's called coronary artery disease. And the coronary arteries are the pipes that supply blood to the heart, and those pipes in our society and in Western society form cholesterol-laden blockages that start impeding that blood flow. And those can cause enough detriment to the blood flow where people can develop symptoms of chest tightness, chest discomfort, and chest pain, or potentially could break open and cause a blood clot to suddenly stop blood flow to the heart, and that's called a heart attack. And that's the plumbing side of the heart. There's also an electrician side of the heart, or electrical side of the heart. The heart is primed to pump, and it's driven by an electrical signaling mechanism which controls how that pumping works. And those electrical signals sometimes get short circuits in them and go haywire, and you can have heart rhythm disorders or arrhythmias. Those are principally handled by electrophysiologists, but we have tremendous abilities now to be able to diagnose heart rhythm abnormalities and treat them, and in many times cure them with procedures called ablations. And then sometimes things go wrong with the circulation of blood within the heart, whether you have a hole in the heart or whether you have abnormalities within the valves that control how blood moves through the heart. And we have, and this is structural heart disease, or problems with the structure in the blood vessels, or in particularly the heart. And so we can work on the valves. And valves have two principal problems that can happen to them. One is they become stenotic, which means they don't open wide enough, and so they impede blood flow from going forward. And the other problem is that they leak, and the medical term for that is regurgitant, or they leak, and so blood goes the wrong way. And then we talk about cardiovascular disease. This involves the vascular system. So, if something can go wrong in the coronary artery, the coronary artery is a blood vessel, the same thing can go wrong in any other blood vessel. It can go wrong in the blood vessels to your legs, it can go wrong in the blood vessels to your neck and your brain, or to your arms. And so this is a vascular disorder, which has a lot of the same things as a coronary artery disorder does, but more of a vascular or whole body type of a nature to it.